It does so by stimulating the cytochrome C in mitochondria. This leads to increasing nitric oxide, so promotes angiogenesis and vasodilation to help with swelling. It produces increased ATP energy for cell repair, increases fibroblasts, and it also increases reactive oxygen species to help with endogenous antioxidant pathways. There's also evidence it reduces inflammatory cytokines, interleukin-1, interleukin-6, tumor necrosis factor alpha, and it also reduces COX-2 and mRNA expression. So particularly when you're managing otitis externa, when you might have to rely on steroids to control inflammation rather than non-steroidals, you've got a really good way of balancing that with providing analgesia with the laser, when you obviously can't give the non-steroidals that you would normally want to. It is important, particularly in dogs, that we think about providing safety goggles for them when we're dealing with the ear, or importantly, just directing the laser away from the eyes. You could put a towel over their eyes if you worried they might move. I would recommend this in cats because they're a little bit more unpredictable. It has been patented to reduce pain, swelling and inflammation. For safe delivery, it's also important to think about eye protection for the handler. As I say handler because it used to be the owner, but these days we tend to use another staff member to hold the animal while laser is being given. It's because there is reflective surfaces within the room, so it's important to remove leads and collars and anything that could cause additional scatter. Again, remembering that if there is any risk of any tumours, keeping it away from hormonal tissue as well. Even though there isn't being shown that there is significant increase in risk of increasing neoplasia, just because the effects it has on angiogenesis, it's important that we don't use laser when there is anything of that going on, and also avoiding use in any pregnant dog or cat. Important to think about positioning because it might take a good sort of 10 or 15 minutes when you're doing some of the longer treatments, so make sure everyone's comfortable, providing comfy beds, not always for the vet, but mostly for the patient. So, in terms of otitis externa, we've got a number of different factors, as you know, that can predispose to difficulties in its management. So we've got predisposing factors of conformation with narrow ear canals, or excessive hair, excessive moisture in the environment in the ear canal, or often inappropriate treatment that the owner is given that has maybe caused some additional ulceration and meant that the dog is actually quite difficult to handle because there's quite a significant pain element going on. There can also be primary causes. So first of all, we always think of allergy, food allergy, atopy, other endocrine diseases, immune-mediated disease, foreign bodies. I've often had to sedate a dog to actually find the grass seed in the ear because it's just too painful to deal with without the dog being still. So that goes for all cases of otitis externa. Sedate them if you need to, but certainly applying laser early on in the course of disease, sometimes you can manage to examine the ear canal without having to sedate them if initially you apply some laser to begin with. It's really important to rule out concurrent bacterial or fungal infections and deal with any excess debris build-up, because one, the infection isn't going to settle down if there's huge amounts of discharge there. But again, the laser isn't going to work as well if we've got tons and tons of debris building up within the ear canal. Obviously, perpetuating factors, certainly dealing with long-standing recurrent ear disease, we can get stenosis of the ear canal, ulceration, thickening of the epidermal and glandular layers of the skin, and you can also deal with otitis media, which in itself, obviously, you know, there's other resources that you can look for managing otitis media. So the benefits of MLS laser, it provides 2 wavelengths of laser. 808 nanometers and 905 nanometers, and they're pulsed emissions, so it prevents overheating of the tissue and prevents any thermal damage occurring within the skin that you're treating and within the tissues that you're treating. It will penetrate a little bit more than other lasers, certainly with class 3 lasers, so you can have a much increased effect in a shorter time frame, which is one in practice very important in terms of having a treatment that you can use quickly and easily, but also for the dog, if they've already got a sore ear, you don't want to have to prolong the treatment. To maximise the results and stabilise the condition, you will find that after the first application of using laser that you tend to get a really good effect with analgesia. This is cumulative, so each time you use the applicator, if you apply the laser, you'll get additional benefits of increasing the amount of effect on the swelling and on the inflammation. But even if you only use it once, it's still an important modality to think about. It will reduce inflammation and provoke resolution of the disease sooner. It will reduce swelling and edema, which particularly in knee disease is so important. We've got a really good variety of either once daily, once weekly, or I think there's something now that will last even longer. But if the ear itself, if the ear canal is so swollen, there's no way that you can apply that medication. So it might be worth thinking about starting the laser first, maybe with some systemic anti-inflammatory steroids, and then applying that long-acting topical treatment once you've done the cytology, once you've got the results of any culture and sensitivity that you're going to be doing. It helps to stimulate collagen synthesis, so we know this from studies done in wound repair, and you'll find that there'll be less reliance on medications, and you can decrease the dosage of those or frequency. So in general, how does laser work? Where does it work to reduce the problem with otitis externa? So obviously, having discussed lots of different factors, this is just a summary, really, this slide of what can happen and what happens within ear disease, where it leads to potentially hearing loss, excess amounts of discharge, and then chronic changes. So the MLS laser will work in a number of different ways on this pathway, and obviously what our aim is to reduce inflammation to try and prevent the chronic changes happening. So even though there hasn't been studies done in looking at otitis externa itself, there has been lots of studies to show it's anti-inflammatory. There's also evidence that it will work to disrupt the biofilm that forms in ear disease and other skin diseases. It's antibacterial, antifungal, and I'll go through some studies briefly on the next few slides where this is where to look for the evidence of this. We know it reduces pain in lots of other inflammatory conditions like osteoarthritis, but it also, because of those pathways that it acts on, it helps to reduce edema and increases wound healing. So we know through both human studies and in vitro studies that, and systemic reviews, that pain analgesia is a really big part of how laser, the effect, will work. There has been shown that there's enhanced macrophage and neutrophil response in fungal disease. It also helps to disrupt the bacterial infections, and certainly it's been shown in some MRSA. Obviously, we know it's to do with staph intermedius infections in ear disease, or potentially other disease as evidence of effect in Pseudomonas as well. With wound healing, it does help promote wound healing. We'll go more into that in other lectures. There's lots of work done in humans, how it helps diabetic patients with wound healing, because that's obviously a major problem in diabetes in people. It's mostly in the dentistry field that biofilms have been shown that they're reduced with the effect of low-level light therapy. And with aural hematomas specifically, there is anecdotal reports that used in combination with surgical repair, it can reduce the need for bandaging and help with surgical repair. Mostly this is probably due to the effects on fibroblasts and the inflammatory cell function shown there. So in terms of practical settings, for the acutely painful ear with the MLS laser, what you want to be doing initially, there's two areas that you want to treat. So you want to treat directly to the ear itself and the external meatus, and I will normally use scan mode for that with chronic inflammation. You may need to hover 0.5 centimetre away from the surface of the ear. Obviously, cleaning the ear thoroughly is important, but I would still not touch the skin when you're doing this phase of the laser treatment. Then we can go on to you treating the ear canal. It will penetrate up to 4 centimetres. So even it will treat both the vertical canal and the horizontal canal. And you want to treat those both with chronic inflammation point setting, because this tends to be a bit quicker than the scan mode, and for chronic pain point setting. That will give a total dose of up to 8 joules per centimetre squared. The frequency really depends on how severe it is. Just like, you know, there's different degrees of swelling. If this is a chronic case, you may need to use it every day. Usually but if there is, you're using some of the longer acting preparations to treat the ear, to treat concurrent fungal or bacterial infections, then potentially once a week may be enough in an ear that isn't too painful. So in general, you want to treat the superficial, the pinna and the external meatus about 3 to 4 joules per centimetre squared. The deep component 8 to 10. And if there is severe hyperplasia, then you may need to increase that even further. This has been taken from one of the laser references, the book earlier that I was referencing there. So in general, what we'll do is with a MAR presentation, we'll use even just one treatment is sometimes sufficient. A moderate case, 3 to 4 treatments once or twice a week. With severe cases, you may need to be doing repeated ear flushings. You can actually use the intraoral probe to treat in the ear as well. And you can use it on sedated patients if you need to. We usually like to use the laser just so we get a little bit of feedback at the time, but it's perfectly safe to use on a sedated patient as well. It's ideal to use after you've got your cytology, when you're waiting for your culture results, before you're starting any topical treatment. Sometimes I'll just use a cleaner for 2 or 3 days while the ear canal is opening, if we do need to wait until those systemic steroids have done some work, or equally just 2 or 3 days of using the laser will help to reduce the swelling so that we can then clean the ear canal thoroughly. And just remembering that systemic steroids don't actually really have much analgesia action, so it's really important that we are providing some comfort to these patients. So after treating the ear canal, if you are flushing the ear, you can use the gingivitis stomatitis setting, and then increase, I can show you this a little bit later, increase the joules per centimetre squared to 1 joule per centimetre squared on point mode. And that will be a very short treatment, normally about 5 to 10 seconds. And you can do that while the dog's asleep, and then later treat the pinna. Obviously, sometimes with chronic ear disease, there is no other option but doing a TCAR or a bulosteostomy. So we end up without the ear canal itself, but we've still got chronic thickening and inflammation and potentially skin disease as well, or the other ear still may need treatment even if one ear has had surgery. So I'd certainly think really with chronic ear disease, the aim is to reduce pain, improve quality of life, hopefully have less frequent flare-ups, and you will sometimes need to use much higher laser settings than you would normally do in phase to begin with, and then move on to a draftation phase where you're treating them maybe once a week for a month, just like you would in arthritis, and then moving on to more monthly treatments. So again, you'd use chronic inflammation setting on the pinna, and then ventral to the external meatus, where you're going over the vertical horizontal canal. You want to use both chronic inflammation mode and chronic pain mode. And you'll literally do that 2 or 3 times a week until you control the pain and the swelling, and then you'll taper. And it's also a good opportunity, even if you're doing it monthly, to combine that with potentially a cytopoint injection if they're also being treated for allergy, if that's the underlying cause. It's also an opportunity to do another swab in the ear and just check that the health of the ear canal is good and pick up infections early. So with aural haematoma, I think it is really important to make sure we're ruling out any underlying causes of the disease. So making sure there isn't ear mites that have caused excess head shaking, make sure there isn't allergy, treat the, just as we would before, if there is concurrent otitis externa, because it'd be much more difficult to settle down the haematoma if we've still got a lot of head shaking because of another condition. Huge numbers of different ways of treating a haematoma. It can simply be draining it, particularly if it's quite small. I've had really good results with this. Just drain it with a needle, sometimes adding some steroids into that lesion. Sometimes surgical drainage is required. There's reports of vacuum drains being used, actually sewing in buttons to the dog's ear, punctate incisions, but very often, whatever treatment that you're using, you end up with an ear that's very swollen, very painful, and the dog has to go home with a dressing like this on its head, and it's really uncomfortable, and the owner finds often, all with good intentions, they come back within about half an hour and have got to replace this dressing. You've got very dog who's very unhappy. So adding in laser can really help with that swelling that we get post-operatively. It's best to treat the whole of the ear flap on both sides in scan mode, and in general with a total dose up to about 6 joules per centimetre squared. Bear in mind you're going to be treating both sides of the ear, so you may want to use a total of, say, 6 to 8 points, so that you can cover, depending on how big the dog is, how big the ear is, see how you get on. And often that means that you don't need to apply these dressings. And in general, you know, rather than it needing treatment for, you know, and redressing for up to 2 weeks, you tend to get resolution in sort of 7 to 10 days. So dealing with cats with ear disease, it is a lot less common than we see in dogs. Primarily because their ears are upright, so they don't tend to get as many problems with excess moisture within the ear canal. Most of the instances I've seen is there is a concurrent issue with ear mites. And obviously, just like kittens can be prone to getting them, older cats, once they get an ear mite problem, can have severe infestations, particularly if there's thickening or long-standing polyps in the ear. And often, you know, cytology is really important to make sure there isn't any sort of yeasty or malassezia issue. But equally, even x-rays, sometimes you do need to think about other imaging like CT or MRI to actually have a look at the inner ear and make sure there isn't any polyps there, because you can't always see them. They might be pressing on nerves, but you can't always see them from the outside. We're quite limited to what topical treatment we can use in cats as well, and certainly there's I don't like putting in, if I can avoid it, any even cleaning products can be quite harmful to cats, particularly if there is damage to the tympanic membrane. Or obviously remembering that we can rarely include analgesia in our standard treatment, and in cats we can't we haven't got the luxury of adding additional paracetamol, obviously. So if you have got a cat with a really painful ear, it is worth thinking about adding in your laser treatment once or twice a week. Normally 3 to 6 treatments are more than adequate to control an acute outbreak. And then if there is a chronic problem, then thinking about having them into the clinic every 3 to 4 weeks to help clean the ear, because the owners often struggle with this, particularly in cats. And then at that time, you can also then give them a laser treatment to help reduce any ongoing thickenings. So we'll go on. I'll just have to go and find my dog to go on to the practical demo of using the MLS laser now, and we'll try and cover those areas there. If I'll just there. In fact, I will just go on to my other camera. So as I was saying before, when you're treating aural haematoma, if this is the screen that you get to at the beginning, you can just go on to companion animal and treat with chronic inflammation setting. So that would be 4 joules per centimetre squared, and it would take you 2.5 minutes. You'd have 6 points to treat and you could increase that if you wanted to, just to go up to 8 points. The actual dosage would stay the same, but you deliver slightly more joules if you needed to do that. Or the alternative, if you're actually treating after you flush the ear and you want to treat within the ear canal, you can go back to this screen, you can use your other head, your intraoral head, and then if you go on to the gingivitis setting, and then just increase the time until you're up to just about 1 joule per centimetre squared. It will automatically reduce the intensity by 25% because you're obviously getting a lot more intense treatment with the head there. I can't demonstrate that today because I really need the patient sedated for them to tolerate that. But that is something to think about once you've flushed out the ear, which should really help with the swelling if you've got a huge amount of swelling there. So I'll go and get my dog. Hi, it's Lizzie calling from Liverpool. I would say, you know, that might be pretty. Oh, okay. See you then. Bye. Yeah. I did also want to mention about the book that we have got available. Those of you who've had your machine for some time may not have had that. So there is more details on lots of different conditions, but particularly we've been looking at the otitis externa just there for you today. So there goes into a lot more detail. So we've got Rosie here again today. Hello, Rosie. How are you doing? All right. She does have quite fluffy ears, but they're actually pretty well at the moment. So what we would do is set up the machine on chronic inflammation setting. And we put that in point mode. And we have that starting. So that's all ready to go. I'm not actually going to start it now because one, we haven't got the glasses on yet. Okay. So what we do is in scan mode, first of all, we would then scan across the ear, back and forth, particularly concentrating on areas where there is redness and swelling. You could do this in a circular motion, and where you might then end up giving a little bit more treatment to the area that is inflamed. You could do that, or back and forth so that you don't miss any area out. And in general, you shouldn't need to treat the other side of the ear when you're dealing with otitis externa. That's only when you've got swelling and wounds from if you've got an aural haematoma. So after you've treated the ear on scan mode, you then go on, reset your machine, go on to chronic inflammation setting on point mode, and then what you do is then over the base of the ear, you then do 3 points down and then around the base there. And when you're using the laser, it's really important not to have it facing forwards, because obviously, particularly in flatter-nosed dogs, they could be, so it's important to be facing your laser this way around. We haven't actually got it going or started yet. So, so that any reflection or anything like that would not interfere. Like I say, you could put a towel over their head, or a hand, or you can get the safety goggles, but sometimes they actually find them a little bit uncomfortable. So sometimes just covering the eyes makes it a little bit more comfortable for them. So that's what you do to treat otitis externa. When you're treating aural haematoma, often the dog may be asleep, so you could treat it while they're asleep to help with edema. Just go back onto the other camera now. So what you would do, there is actually a setting, if we're dealing not just with the pain, but we're dealing with edema, you'd actually set it here on the machine for edema, and normally using scan mode, that gives you the dose rate of 4 joules per centimetre squared, and then depending on 50 centimetres squared, if it is this, that would be appropriate for Rosie here, so that's what we do for Rosie. If it was a Labrador or German Shepherd, then obviously quite a large pinner, so we'd probably increase that to maybe 70 centimetres squared, still with the same dose rate, but we deliver more laser. And in scan mode, you're looking at 3 minutes 50 seconds. If you do find that your dog is just a bit more jumpy and you haven't been able to sedate him, or it's for a second treatment after he's coming back, then I would probably go down to point mode, and then you'll find even though you're delivering a similar amount of laser, because it's penetrating better, the time it's a lot shorter. So you could do that once if it's repeated treatments. So when we're looking at aural haematoma, we would normally use 6 to 8 points within the ear. So I'd normally use 4 points on this side. 1, 2, 3, 4. And then again on the other side, there's often quite a lot of swelling behind the ear. 1, 2, 3, 4. And that would be normally on the day of surgery, a post-op check 2 or 3 days later, and then again a week after that. And that would normally be sufficient for treatment. And then, you know, stitches out a week after that, and all sorted. Okay, thank you very much. Let's see if there's any questions. Thank you very much.